Nursing Theory 5120. We are going to present the mid-range theory of caring done by Kristen Swanson. My name is Amanda Kyle.
I'm Salewa Adegboyega.
I'm Jessica King.
And I'm Kylie Daniels. Dr. Kristen Swanson was born January 13, 1953 in Providence, Rhode Island. She obtained a baccalaureate degree from the University of Rhode Island, 1975. She was also magna cum laude. She obtained a master's degree from the University of Pennsylvania in Philadelphia in 1978. Her PhD was from the University of Colorado in Denver, Colorado. She decided to learn more about human experiences and responses to miscarrying as a doctoral student after one of her meetings. Caring and miscarrying became her focus of doctoral dissertation and program of research. Inducted into the American Academy of Nursing in 1991, she received a Distinguished Alumni Award from the University of Rhode Island. In 2002, she also formulated the theory of caring. Swanson credits book learning and clinical experience gained as a early nursing person. Swanson credits book learning and clinical experience gained early in her nursing career. She gives credit to several scholars. Jacqueline Fawcett's course on the conceptual basis of nursing practice as mastered prepared nurse helped her to better understand the goals of nursing, and that caring was congruent with her personal values. Dr. Watson's influence helped her to explore nursing from the perception of women who miscarried. After this study, she developed the 5 processes of caring. Personal experience with her own child in the NICU developed interest in caring for vulnerable infants. It was then that she developed those interests. Dr. Catherine Bernard for encouraging her to make the transition from the interpretive to contemporary empiricist paradigm, and her experience speaking to public health nurses. With her empirical studies, she looked at 20 women who recently miscarried. She also proposed 2 models from this study, which became the basis of their theory of caring. The first, the caring model, included the 5 basic processes: knowing, being with, doing for, enabling, and maintaining belief. The human experience of miscarriage model was also formulated. She also studied what it's like to be a provider of care to vulnerable infants in the NICU. She discovered through this process that caring was applicable to mothers, fathers, physicians, and nurses. She led an investigation with socially at-risk mothers and explored how they reacted to long-term nursing interventions. After this study, Swanson was finally able to define caring. Swanson used her research with women who miscarried, caregivers in the NICU, and socially at-risk mothers to expand the caring model into the middle-range theory of caring. The theory of caring was later tested. Swanson's intervention research examined the effects of caring-based counseling sessions on the women's acceptance of loss and emotional well-being during their first year of miscarrying and the relationship to time. Swanson's review was 130 investigations on caring, which eventually led to her to propose that the knowledge about caring may be categorized into 5 hierarchical domains. The primary sources from Swanson's research include Nursing as Informed Caring for Well-Being of Others in the Journal of Nursing Scholarship, the empirical development of the middle range theory of caring in the nursing research, Caring Made Visible by Creative Nursing, and the Theory of Caring, our book by Alagood and Toomey, Nursing Theorists and Their Work.
My name is Amanda Kyle again, and the major considerations for her theory were person, and to person she meant that a person was growing and ever changing, and as people we strive to connect with others, and we're influenced by our environment, and a person has their own free will to choose what they want to do. The environment, Swanson believed to be situational. Sometimes the environment was the client, but other times the environment affected the client. Anything can influence the environment, such as spiritual, social, economic, and even psychological concerns. To Swanson, she viewed health as very holistic. The person needed to be able to mold their inner pain and develop it into new meanings and grow to truly be healthy. With nursing, she also thought it was a wide range. Not only scientific research went into nursing, but also ethical and personal and aesthetic knowledge. With her theoretical assertions, it was developed by a phenomenological inquiry. Her goal of nursing was to continually encourage and inspire the well-being of the client. Nursing focuses not only on health, but also their spiritual and biophysiological aspects. Her theory of caring model ideas are knowing, being with, doing for, enabling, and maintaining beliefs. So we'll further look into those. The first one is maintaining beliefs. What that is that we can have a positive outlook and be able to encourage our patients that you can make it through your hard times. It can be very individualized to that patient and their situation, or it can be in general, like in general laparoscopic appies do well, or very individualized that you have a 13-year-old with a going through a lap appy, and they need the extra caring and they don't understand why they're thrown up after anesthesia, and you just kind of have to love them through that situation, but continually encourage them that it is going to get better and this is just a short time. Knowing is gathering the information about your client. The nurse has to go in with no stereotypes on this type of client, or this person automatically does this just because of who they are, and it promotes the nurse-client relationship. So you just gather the information and go from there in a well-rounded way. Being there for your patient shows that you're truly there for your patient, not only just because you're a nurse and you're just there, but that you do care about their situation and you do care about how they're going to overcome this struggle that they're going through, whether it is emotionally with the death of a child, or through Swanson's miscarriage, or even if it is just a surgical procedure. You develop an emotional bond with your patient, and it shows that the nurse is not only there in that moment, that you truly care about being there afterwards to see them through the entire process. Doing for, Swanson believes that it's the things that the patient would normally do for themselves, but they can't do at that time. Maybe because they're in pain, or they just don't have the strength to do. And it can be physical, or it can be emotional. In any way, you always have to maintain your patient's dignity, because it is important. This is a short time in your patient's life, and so we always have to uphold their dignity and continually respect our patient. Our goal is to encourage them to get stronger again, restore their strength so they can be once again independent and fully functioning. Enabling is the nurse's responsibility to see the patient through the transition. The nurses can do this by coaching, offering positive feedback, helping them to see other healthy alternatives in their situation, and we just have to continually move the patient forward through their processes and not let them regress in the caring process. This is a schematic that kind of puts it all together, and it just kind of puts it from one to the next, starting off with maintaining belief and encouraging, and going into knowing about your patient and being there for your patient, doing for your patient, and also enabling your patient to see through that transition period. And it all ends up to encourage the client well-being.
While Swanson was developing her theory, she chose to use inductive reasoning for the main reason that it allowed each case to be individualized and unique to that client interaction. Swanson proposed specifically that the factors of knowing, being with, doing for, and enabling belief are essential for building the nurse-client relationship. Swanson's theory was originally based on stillborn births and miscarriages, but can be applicable to any form of nursing, as we all have encountered individualized patient situations. You may have a general subject, such as Amanda said, a laparoscopic appendectomy, that may be very easy for a young patient to overcome, but may be more difficult for an older patient that is diabetic and suffers from congestive heart failure. In current practice, Swanson's theory is considered a framework because it is so applicable to all ranges of nursing. Swanson's insight into the significance of caring is highly regarded within the nursing profession. It's also highly regarded in most nursing programs. Caring is an essential building block of how they prepare young nursing students to act in real client situations. Nurses create an optimal environment by incorporating all 5 of these caring processes. This not only conveys true concern, but also promotes the nurse-client relationship, because the clients feel that the nurse is truly present with them and truly cares about them as an individual, not as a case. Caring can be a very difficult concept. It's not something that can necessarily be taught, but must be already understood by the student. If the student comes into the nursing program with a preconception of what caring should be, they're probably not going to understand this concept very well and are not going to advance the profession as they should. Nurse educators should always engage students into the quote-unquote language of caring, and what that basically means is having the student what it means to be cared for and what it means to truly give care and be there with your patient. Current research on Swanson's theory focuses on the assessment of patient in vulnerable populations. We've all seen patients from different racial and socioeconomic backgrounds. The importance of creating a caring environment for elderly patients, as we are seeing a more aging population in our hospitals today. And it also focuses on nursing guidelines for working with patients specifically with multiple sclerosis, but can be applied to a wide range of disease processes.
Hi, I'm Salewa Adegboyega again, and I'll be talking about implications. Swanson's theory of caring can be applied to our clinical practice, and being advanced practice nurses have been going to school for APNs. Her initial research was actually geared towards women who had miscarried. But this model can also be incorporated into screening processes for patients who've had anal dysplasia. Most of these patients are HIV clients, and what they did was they had this model, the medical model they were following for the HIV client population. So what they did was they incorporated Swanson's caring model, which made a more comprehensive or holistic model. I'm going to talk about a clinical scenario for the caring model. Mr. J was brought to the hospital, to the ER, by his wife due to an acute onset of chest pain. They did some lab work, some EKG, and they found that he was having myocardial infarction. They got a cardiologist on the case, and they took him to the catheterization lab. During the process, the cardiologist realized he was going to need a bypass, a coronary artery bypass graft, because he had multiple blockages. So he was referred to the heart surgeon. The cardiologist talked to him about, what was going on briefly, and promptly left the room. The patient was transferred to the step-down unit. He was very anxious. There were lots of misinformation because the cardiologist didn't fill him in on the prognosis and what was going on. So the APN came in to see Mr. J. She always incorporates the caring model into all her practice, and this case was going to be no different. So she came in and introduced herself, did her assessment, and realized that there was a lot of information missing. She incorporated Swanson's knowing caring process by avoiding assumptions and centering on the client and wife's needs. According to Swanson, nurses' knowledge of self sets the stage of how truly a nurse is releasing the client's reality. She incorporated being emotionally present and allowing her client to share his feelings on the procedure. She also incorporated doing for by anticipating the needs of her client by providing the needed education. She incorporated enabling by coaching the client through post-op equipment like incentive spirometers and different equipment that the client was going to need. And through all this, she maintained belief, knowing that he was going to do well and he wasn't going to have any problem with the procedure. On her morning rounds, the day before his scheduled cabbage, she went over the clinical pathway for cabbage and prepared him for what to expect after the surgery. The client did well. Mr. J did well in his surgery, and he was very appreciative of all the care the APN provided. In summary, the caring relationship between the nurse and the client is essential to the well-being of all patients in all clinical areas. Swanson's caring processes are not mutually exclusive. The 5 caring processes overlap as in the clinical practice of nursing. Without a caring attitude or philosophy as a nurse, we'll limit ourselves to what we can truly become. It is a caring relationship that will learn the most about the practice of nursing. And that's the end of our presentation. My name is Salewa again.
I'm Jessica King.
I'm Kylie Daniels.
And I'm Amanda Kyle. Thank y'all.
Thank you.
Thanks.
Did we go past?